What's that?
Welcome to Murphy and Company. And today I have a very, very special guest. And before I introduce him, I'm going to tell you a little bit about a personal experience in my life and why the subject matter of today's interview is so relevant today, and how not paying attention to this subject can change lives in a very negative way. Now, the story I have to tell is about my family. When I was 18 years old, my parents and my two younger teenage brothers, and my mother, who was 38, my father was 48. We lived in a ritzy town in Long Island. Tremendous stress on my father, financial stress at the time. This was in the 60s. One day, he had a pain in his left elbow, and he walked over to the local doctor, who said, "Oh, let me put a tourniquet around it. You've got tennis elbow." My dad walks home. My parents proceed to a big fight. They were always either mad about each other or fighting like crazy. Unfortunately, this day they had a huge fight. They were both so stressed about finances. And his business was in very big trouble. And they went to bed not speaking. My father had a massive heart attack. He had never been sick a day in his life that we knew of. I had been home from college the weekend before, sitting on his lap. He was fit as a fiddle. Anyway, my mother tried to save him, mouth-to-mouth resuscitation, called for my brother, who ran outside to all the local mansions where doctors lived, left and right, to get them to come and save his daddy. Nothing could be done. He was gone. My mother at 38 was left to raise 3 teenagers. I came home from college, had to work my way through a local school, lost our huge house, no will. Who expected such a thing? Everything was different in one instant. And I learned 2 things from this. I learned, try to forgive people right away. Try not to hold a grudge. Try to move on and not be mad. You never know. Life is short. Tell the people you love that you love them when you can. My dad was a great man, so I dedicate this show to Elliot Murphy. And I'm here to talk about the fact that I keep a close watch on this heart of mine for a very good reason. My family history, and I've chosen the best cardiologist I could find. And I'm here to welcome you today to meet Dr. Michael Wolk, my cardiologist, my hero. And he keeps a close watch on this heart of mine too, knowing my family history. And we're here today to talk about all the strides that have been made since those tough days long ago. But first, Dr. Wolk, I know you've been the past president of the American Heart Association, and you have so many accolades. Can you tell the audience, because I know you so well, I know he was going to be an astronaut. Instead, he decided to keep his feet on the ground and save our lives. So tell us a little bit about yourself, and then we'll talk about progress in your field.
Well, Michelle, I was rejected as an astronaut, although my roommate at Columbia Medical School was a gentleman by the name of Story Musgraves, and he went up 6 times.
Oh my God.
And actually fixed the Hubble Space Telescope. So I went on to more pedestrian things and became a cardiologist. I've been at Weill Cornell Medical School and New York Presbyterian Hospital for over 40 years, and I practice part-time there, but I also do work with the physician organization to try to improve the quality of care, reduce the cost of care for our physicians and for our patients.
Wow, that's wonderful. And you have made some great changes in your own private career going forward at this point. Do you want to tell us a little bit about that?
Well, I think basically we have moved away from full-time practice and devote a lot of time to making medicine better for patients. We have set up a heart foundation that is supported by our patients and friends, that really has worked well over the last 25 years. We've raised over $6 million, and it's supported not bricks and mortars, but it supported young people beginning their careers in cardiovascular research, teaching, and education. And we've developed some of the leading scientists and clinicians in cardiology in this world over that period of time, and we're very proud of the seed money that we provided to help these young individuals out.
Now, bringing it right back home, recently there was an East Hampton symposium on cardiovascular disease. What exactly was the focus of that for those who were fortunate enough to be there? And I know you hold these occasionally.
Right. This was our second one in 8 years that we did in the firehouse. It was
Yes,
well
again.
attended, and if we didn't stop the audience from asking questions, it could have gone on for 4 or 5 hours instead of the allotted 3 hours. But it's meant to prevent what you just described in your own family. People should not be dying of cardiovascular disease in this world. If we teach individuals how to prevent having cardiovascular disease and understand the risk factors. So it really is a symposium to teach individuals. Maybe they can teach their children, maybe they can teach their grandchildren, because it's foolish to think that 10 or 15-year-old kids should have heart disease 30 or 40 years down the line. And so we can prevent it. And we started with the story of President Dwight D. Eisenhower, because in 1956, we knew nothing about heart disease. And President Eisenhower had chest pain on a golf course in Kansas City. It was Cherry Creek Golf Club. He was playing golf with the head pro. And basically, he had chest pain that was unrecognized by the White House physician, Dr. Howard Snyder, for 36 hours, until finally he was taken to Fitzsimmons Hospital outside of Kansas City, where he was diagnosed. And at that time, the nation thought that people, once they had a heart attack, were no longer functional. And in an attempt to reassure the country, Richard Nixon, who was the vice president at that time, called in Paul Dudley White, a non-military cardiologist, who came to Kansas City, examined the president. And you may remember he did a television program the next day to reassure the nation. And in that program, it was the first time ever that he mentioned risk factors that cause heart attack and how to avoid them. For example, Eisenhower smoked 3 packs of Camels a day since West Point. He had high blood pressure. He never exercised. And so Paul Dudley White was trying to bring to the attention of the American people that this is a treatable, preventable issue. And of course, Eisenhower went on to win the next election and was president for 8 years and died only about 13 years later, but he died because of multiple heart attacks.
He did. And he was a relatively slender guy, and he looked fit. Thinking he had been in the military, people wouldn't have expected such. So that was a wake-up call. And this was a time, you said 58, so this was a time when people were still smoking. And so the fact that this doctor said this on the air, did it change people's behavior, do you think, about smoking even?
Well, I think it was the first time that people understood there were causes of a heart attack, that heart attacks are preventable. Cardiovascular disease is preventable.
Yes.
And I think our whole symposium in East Hampton in early November was an attempt to tell folks that you don't have to have a cardiovascular episode. And your children certainly don't have to have, and your grandchildren should never have an episode of cardiovascular disease.
Now, very recently, I'm just going to go off topic for a moment, but this is on everyone's mind. We had an incident here, tragic incident, with a well-known gentleman of 68 who died of a massive heart attack in his home here in East Hampton. And the problem was they couldn't get the help quickly enough to him, and everyone feels his life probably could have been saved. So that's a problem we're having out here, is getting people the right help in their homes immediately. Are you familiar with this situation that happened?
Yes, I know of the individual who passed away. And we tried to address that in some way in our talk in East Hampton, because we did bring a cardiologist from the community to discuss what would you do if you have chest pain.
Yes.
And I think the recommendation that came out of that is that clearly, if you can take an aspirin and chew it very carefully, immediately if you think it's a heart attack.
Not a baby aspirin, but a
Just
regular.
a whole aspirin.
And chew it.
And
So
call
keep them.
911 immediately.
Okay.
Get the paramedics to take you to the hospital.
Yes.
If there's any delay, maybe the family could, although it's best to be under the care of paramedics. And at this time in East Hampton, they can provide therapy where they can break up the clot. And if they think more should be done, patients like this are being transferred to Stony Brook, where they can have their arteries open with a catheter balloon.
Right. Okay. So we're working on that, and that sounds like excellent advice. Keep those aspirin around. Make sure of that. Now, what exactly is cardiovascular disease?
So cardiovascular disease, cardio is the heart and vascular is the blood vessel.
Yes.
So we're really talking about blockages in blood vessels that go to the brain, causing a stroke, to the heart, causing a heart attack, or blockage of vessels to the legs, arterial vessels, that cause claudication or loss of limb. And we're talking about cardiac disease, whether that cardiac disease be heart failure because of multiple heart attacks, as President Eisenhower had, or other illnesses of the heart muscle, or an arrhythmia of the heart muscle.
Yes. And how would one actually diagnose that?
Well, basically, we would like to, there are many ways to diagnose it, but certainly going to an annual exam to have yourself checked is helpful to understand, and we'll talk more, I'm sure, about the risk factors. But the way to diagnose heart disease or vascular disease is a good exam to check the circulation in the carotid artery by listening to the carotid artery, to take an electrocardiogram and or a stress test to see how the heart performs and ensure that there's an adequate amount of blood flowing to the heart when the heart is exercising, and check the circulation or pulses in the leg. And in addition, with risk factors, taking blood tests to measure other elements like cholesterol, blood sugar is certainly important.
Would you say that cardiovascular disease is the biggest killer today, or is it cancer?
Well, the perception from Americans is that cancer is the biggest killer, but the reality is that cardiovascular disease is the #1 killer in the United States and in the world. 1 out of 3 people die from cardiovascular disease. More people die from cardiovascular disease than all of cancers combined.
Oh, really?
And 17 million people in the world die of cardiovascular disease each year. So it is the #1 killer, and we should understand it.
Yeah.
And it shouldn't be the #1 killer.
Yeah. And I know for women, it's the #1 killer, and women often don't think they're having a heart attack when they feel different, because it's a little different for women, correct?
Well, the perception is it's different. The reality may be that it may not be as different as we think. Certainly women think that cancer, because of breast cancer, ovarian cancer, is the #1 killer in women. But most folk now understand from what they read every day that cardiovascular disease is the #1 killer. But certainly women can present to the physician with some atypical chest pain, and taking good history and understanding who the patient is and paying attention to that patient will help define whether that individual has or does not have cardiovascular disease.
Now, I mentioned before in my family story when I was a child about stress. Do you think that has a great deal to do with people having cardiovascular disease? And we live in such a stressful world, and financial stress is a huge issue. Even here in the affluent Hamptons, many, many people are suffering terribly. What do you think about that?
Well, Michelle, I don't know the facts of your father, and I don't know if in those days we knew a lot about who he was medically.
Yeah.
But I think stress, while it plays a role,
Yes.
there are many other factors that play a much more important role, and that we can address and we can prevent or we can reverse. And so we have to think of those risk factors that are preventable, whereas there are some risk factors that can't be.
Yeah.
A family history of cardiovascular disease. If your
Right.
father, who's less than 55, he was 48 in this case, had a heart attack, then there is an increased risk for yourself, and you need to be further followed.
Yeah.
So family history is a risk factor we can't intervene on.
Right.
Age, we can't intervene on. As we get older and older and older, our blood vessels tend to get harder and harder,
Yeah.
and atherosclerosis gets bigger and bigger and bigger. So age is the biggest factor for risk.
Right.
So it overwhelms even the typical risk factors that you and I know about.
I hear you. All right. Now, for women, the stress test sometimes can give a false reading and cause more alarm than it's worth. I remember you telling me that at my last visit with you.
Well, a stress test is only as good as the person you're doing it on. There are certainly Bayesian theories which simply say that the greater chance you have of having cardiovascular disease, the better the test. So the older the individual, the higher the cholesterol, the higher the blood sugar, the better test it is. To take a 45 or 50-year-old woman and do a stress test, you're going to find a lot of those are not normal, and yet that patient does not have cardiovascular disease.
Right.
So there may be other ways to do it. And one example might be 50-year-old woman comes to your office with chest pain. You can do a simple treadmill stress test as a screen, and if it's normal, that's reassuring. But if it's not normal, maybe you should go ahead and do a $30 or $50 calcium score. So what you do is you just measure the calcium within the three major blood vessels of the heart, a very simple test with very low radiation. And if it's zero or close to zero, the chance of that individual of having an event over the next 5 or 10 years is small. So for that individual, a calcium scoring test is a wonderful,
Kind of
quick way
painless.
to do it.
Is that a MRI or?
It's a CT scan.
Yes, I had that. You sent me to have that.
Right, but
It's
this
very
is
reassuring.
But this is done with low radiation, so
Yes.
it's not like a CT scan of the chest or abdomen
Right.
of the body.
And I like your approach to, you look at the person and decide with that person, it's always tailored differently for each of your patients, I think, with what you know about them. And that's what makes an amazing doctor.
Well, I think you've got to take the time, and time is
Yes.
precious in today's world of medicine, of course.
Oh, is it ever?
But we won't talk
Yes.
about that. But we will say take the time to understand who the patient is, what the symptoms are, and then you can always end up doing the right test or fewer tests just by taking a few extra minutes to
Yes.
understand what the patient's symptomatology may or may not be.
Right. And I know one visit to you, you discovered I had a nodule on my thyroid. Talk about taking the time and going out of your field, which could have been an amazing, like saving my life kind of experience. Luckily, it turned out to be benign, but who knew? But thank you for that. So talk about taking your time. And is there a U.S. or a world approach going on these days to cardiovascular disease? And
Yes, I think there is. I think
Yes.
basically the World Health Organization, the World Heart Organization, and the United Nations has moved away from communicable disease. They used to work on communicable disease, syphilis, and HIV, but now the biggest killer in undeveloped nations is cardiovascular disease. So there's been a big emphasis on 25 by 25, and what that means is trying to reduce the risk of death of cardiovascular disease by 25% by the year 2025.
really?
And so what everybody's trying to do is to look at those risk factors that could be altered, the things we really know about. Is the cholesterol too high? What kind of cholesterol? The LDL bad cholesterol? Is the blood pressure too high? Does that patient have diabetes? Does that patient exercise or not? Do they wear a Fitbit device to make sure they're walking their 10,000 steps a day? How much do they weigh? Obesity is an epidemic in this country.
Yes.
And until we address that epidemic, but those are among those things that if we worked on obesity and diabetes and hypertension, and blood pressure and cholesterol, we can reduce the risk of cardiovascular disease by up to 80%. And that's the point we try to make for East Hampton,
Yes.
that you folks out there and your children and your children's children, if you are careful, should not have cardiovascular disease. But what do you see in the school systems now? You see 35%, a third of children are obese.
Is
And
that
so-
true for our area out here, do you
know,
think?
I can't answer that for your
Right. Certainly in Middle America. I just drove
Yes.
across the country. It's
But
there.
it's significant, and it's
It's
double what it was 25 years ago. So
Yeah.
it's occurring because of what we're serving the kids.
Yes.
I mean, the biggest example is what Mayor Bloomberg was trying to remove was the soda. Why get a 64-ounce or 32-ounce soda for 2,000 or 3,000 calories, which is what all you need in a single day? So obesity has occurred, and the biggest change over the last 25 years that's gone along with obesity is the increase in ingestion of sugary beverages. So I think many school systems, and I can't specifically talk about East Hampton, but virtually all school systems are starting to address that.
And what would you say is the very best diet for one to follow?
Yeah. Well, we've gone through all sorts of fads, as you know.
Yes. Now,
And
gluten-free?
and they've come and gone. But there's one diet, really, and it's the Mediterranean diet, which clearly has persisted over the last 30 or 40 years.
Yes.
And now is even getting more press because basically, as we write guidelines in how to prevent heart disease, the guideline includes information about cholesterol, diet, weight. In the diet section, they're recommending Mediterranean-like diets or linked diets, but Mediterranean-like diets as a strong recommendation based on good evidence, which wasn't there before. So having more fruit and salads and grains and fish and a little olive oil and fruit and vegetables is the direction I hope the audience who's listening to us goes to.
Yeah.
And that's the kind of diet that can last years and years and years, whereas a lot of the other diets that have come and gone and have been one-year fads.
Just quickly on that note, one-year fad, this whole thing about gluten lately, and you see it everywhere. Do you believe this is a real problem in the way we are processing our flour and so forth?
I think basically for those who are truly gluten sensitive,
Yes.
it's really important that they go on a limited gluten diet. But it's very clear that probably there are 100 times more people who are on a gluten-free diet who don't need to be on that diet. So I think I would recommend to folks that they really see their physician, their gastroenterologist, to do the proper test to define whether they are truly gluten sensitive, and so that they can go on an appropriate diet. But we can't tell the country to go on gluten diets, because if you go to any restaurant, even here in East Hampton, we have a gluten-free pizza, et cetera, et cetera. Some of it is necessary,
Yes.
and some not. But let's get not the 1% of people on a gluten diet, let's get 99% of Americans on a Mediterranean diet, and let's get them thinner, and let's get their blood pressure lower, let's get their cholesterol down.
Yes.
Then we'll save tens of thousands and millions of lives. That's what's important, and that's the message that needs to get out.
Yes, and part of my story in the beginning is how heart disease really affects people in a network of ways that's so indefinable and ineffable. It would save the country in so many ways that are under the surface that you're not even aware of. So you think we're making progress?
I think the data demonstrates that. Now, in
Yes.
obesity, we're going in the wrong direction as an example.
Yeah.
But if you look at the cardiovascular death rate per 1,000 people, which seemed to peak in the late 60s, about 10 years after President Eisenhower died, since that time, there's been a flattening of the death rate, and in the last 30 to 40 years, a diminution in the mortality rate from cardiovascular disease by anywhere from 20 to 30%, depending on how you define that response. So clearly we're making great inroads by preventing cardiovascular disease. And unfortunately, if people do have cardiovascular disease, we have great approaches to treat cardiovascular disease with intervention, be that angioplasty or surgery or defibrillator or a pacemaker, which we hope will be used in fewer people as we go forward so that we will have less expense to the country of this disease.
Yes. Well, it sounds like we're going to need a lot less angioplasty and bypass surgery going forward, because it seems the emphasis is on prevention, not just in the surgical procedures once the damage is done.
I think that's a true statement. I think we can intervene for a few people, but it's at great expense. It costs millions of dollars to take 100 people and do bypass angioplasty. But that same amount of money to prevent, we can prevent hundreds of thousands of people from having cardiovascular disease. And also we have found that medical therapy and diet therapy and exercise therapy are good approaches, and that unless you have disabling angina or a very bad stress test, that medication and medicine approach is as good as any intervention that's available, whether it be bypass or angioplasty. So if you look at the last 5 or 8 years, clearly angioplasty has been going down, and bypass has been going down even for a longer period of time, perhaps 15 to 20 years.
Now, when you look at what's happening in medical schools today, do you find there are far more people training in fields that have to do more with prevention than becoming heart surgeons? Because it sounds like that's going to become less important.
That's a great question, Michelle, and clearly there are openings in the cardiac surgery field now in the fellowship programs, because a few of these people now, for the first time in 50 years, are not getting jobs when after 5, 8, 10 years of training. So this is a challenge. So I think some of these programs will compress and will train fewer doctors in that field, which is supply and demand. That's perfectly fine. The problem we have is we need to encourage more people to go into primary care and internal medicine, and encourage them financially, encourage them by quality of life. You know, they work 70, 80 hours a week compared to some fields where you go 10 by 4. You go do a 10-hour shift 4 days a week, and some wonderful fields that I'd like to go into now, but like anesthesia or dermatology, I don't want to pick on them, but I think we need to encourage our young folk more to go into the primary care base where we're going to need more physicians.
And well, on that note, I'm going to invite you to come back again next week if you have the time. Can you steal a few more minutes next week for us?
I'd be happy, but I suspect you want to talk about healthcare reform, a very challenging topic.
Well, yeah, one that we need your input on. So will you come
Absolutely.
back?
Be a pleasure
Oh,
to come
it
back.
would be so wonderful. Okay, we look forward to it. And thank you for taking your time today. I know how precious it is.
Well, thank you
You're
for
the
inviting
best.
me, Michelle.
Thank you. See you next week.
Absolutely.
Okay.
Wolk.